Substance Abuse Counselor. 1. Introduction to Substance Abuse Counseling. Definition and importance. Substance abuse counseling is a specialized field of counseling focused on helping individuals who struggle with addiction to substances such as alcohol, drugs, and prescription medications. The primary goal is to guide individuals toward recovery by addressing the psychological, emotional, and behavioral aspects of addiction. Counselors work closely with clients to develop coping strategies, identify triggers, and create a plan for long-term recovery. Substance abuse has widespread implications, affecting not only the individual but also families, communities, and society at large. The role of the counselor is crucial in mitigating these effects, offering support that fosters hope, resilience, and the possibility of a healthier life. Historical background. Substance abuse counseling as a formal profession has evolved significantly over the past century. In the early 20th century, addiction was often seen as a moral failing rather than a medical condition, and individuals struggling with addiction were more likely to be incarcerated than treated. However, the mid-20th century saw a shift with the introduction of Alcoholics Anonymous, AA, in 1935, which laid the groundwork for peer support and the concept of addiction as a disease. The 1970s and 1980s brought about a greater understanding of the psychological aspects of addiction, leading to the development of more structured therapeutic approaches and the formalization of substance abuse counseling as a profession. Today, it is recognized as a vital part of the healthcare system, integrating medical, psychological, and social approaches to support recovery. Current trends and challenges. Currently, substance abuse counseling faces several challenges, including the opioid crisis, the rise of synthetic drugs, and the growing recognition of co-occurring disorders, when an individual suffers from both a substance use disorder and a mental health condition. Counselors must stay abreast of these trends and adapt their methods accordingly, utilizing evidence-based practices and often working in multidisciplinary teams to provide comprehensive care. Moreover, the stigma associated with addiction remains a significant barrier to treatment, making the role of counselors even more critical in advocating for their clients and promoting a more compassionate understanding of addiction. 2. Role and responsibilities of a substance abuse counselor. Day-to-day tasks. The daily responsibilities of a substance abuse counselor are varied and complex, reflecting the multifaceted nature of addiction. Counselors typically begin their day by reviewing client files, preparing for sessions, and possibly meeting with other professionals involved in their clients' care, such as social workers, psychiatrists, or primary care physicians. During client sessions, counselors might conduct assessments to evaluate the severity of the addiction, develop and implement treatment plans, and provide one-on-one or group therapy. They also offer crisis intervention when necessary, especially in cases of acute withdrawal or relapse. Documentation is a crucial part of the job, ensuring that all client interactions and treatment plans are thoroughly recorded. Ethical considerations. Ethics are a cornerstone of substance abuse counseling. Counselors must navigate complex issues such as client confidentiality, informed consent, and the dual relationship between counselor and client. For example, maintaining confidentiality is paramount, but there are situations where the counselor is legally required to breach confidentiality, such as when a client poses a danger to themselves or others. Another ethical challenge is managing the power dynamics between counselor and client. Counselors must be careful not to impose their own beliefs or solutions, but rather empower clients to make their own decisions. This requires a balance of guidance, support, and respect for the client's autonomy. Working with different populations. Substance abuse counselors work with a diverse range of clients, each with unique needs and challenges. Adolescents, for example, may struggle with peer pressure and identity issues that contribute to substance use. Counseling this population requires an understanding of adolescent development and an ability to engage them in a way that feels relevant and non-judgmental. Veterans are another group that may present unique challenges, often dealing with trauma and PTSD in addition to substance use. Counselors working with veterans must be equipped to handle these co-occurring disorders and understand the military culture. Adults, especially those involved in the criminal justice system, may face legal issues, employment challenges, and a history of failed treatment attempts. Working with this population often requires collaboration with probation officers, employers, and community resources to support a holistic approach to recovery. 3. Education and training requirements. necessary degrees and certifications to become a substance abuse counselor. Individuals typically need a bachelor's degree in a related field such as psychology, social work, or counseling. However, a master's degree in counseling or a related discipline is often preferred, especially for those looking to advance into supervisory or specialized roles. In addition to a degree, certification is usually required. The requirements for certification vary by state but generally include completing a certain number of supervised clinical hours and passing a state or national examination, such as the National Certified Addiction Counselor (NCAC) exam. Some states also offer specific licenses for substance abuse counseling, such as the Licensed Alcohol and Drug Counselor (LADC) credential. On-the-job training education alone is not enough to prepare a counselor for the challenges of working with substance abuse. On-the-job training, often in the form of internships or supervised clinical practice, is essential. This training allows aspiring counselors to gain hands-on experience working with clients, learn how to apply therapeutic techniques in real-world situations, and develop the interpersonal skills necessary for effective counseling. During this period, trainees typically work under the supervision of experienced counselors who provide feedback, guidance, and support. This mentorship is invaluable in helping new counselors navigate the complexities of the job, from handling difficult client interactions to managing the emotional toll of the work. Continuing education and professional development. Substance abuse counseling is a dynamic field that requires ongoing learning. Continuing education is not only a requirement for maintaining certification but also a vital part of staying current with the latest research, treatment modalities, and legal and ethical guidelines. Counselors can pursue continuing education through workshops, conferences, online courses, and advanced certifications. Professional development also includes seeking out supervision and peer support. Many counselors participate in regular supervision sessions, where they can discuss challenging cases, reflect on their practice, and receive feedback from colleagues. This ongoing professional support helps counselors continue to grow in their practice and prevent burnout. 4. Therapeutic techniques and approaches. Cognitive behavioral therapy, CBT. CBT is one of the most widely used therapeutic approaches in substance abuse counseling. It is based on the idea that unhealthy thoughts and behaviors contribute to addiction. The goal of CBT is to help clients identify and challenge these patterns, replacing them with healthier thoughts and behaviors. For example, a client might have the belief that they need alcohol to cope with stress. Through CBT, the counselor would help the client recognize this belief, understand how it contributes to their addiction, and develop alternative coping strategies, such as deep breathing, exercise, or reaching out to a support network. CBT is highly structured, often involving homework assignments that encourage clients to practice new skills outside of sessions. This approach has been shown to be effective in reducing substance use and preventing relapse, making it a cornerstone of many treatment programs. Motivational interviewing, MI. Motivational interviewing is a client-centered approach that aims to enhance the client's motivation to change. Unlike more directive forms of counseling, MI focuses on exploring and resolving ambivalence about change. The counselor works collaboratively with the client, using open-ended questions, reflective listening, and affirmation to help the client articulate their own reasons for wanting to change. MI is particularly effective with clients who are resistant to change or who have had multiple relapses. By fostering a non-judgmental and supportive environment, MI helps clients feel empowered to take the first steps toward recovery, even when they are unsure about their ability to succeed. 12-step programs. 12-step programs, such as Alcoholics Anonymous (AA) and Narcotics Anonymous (NA), are peer support groups that provide a structured approach to recovery. These programs are based on the idea that addiction is a spiritual and moral failing that requires a process of personal and communal transformation. While 12-step programs are not professional counseling per se, they often complement formal therapy. Counselors may refer clients to 12-step meetings as part of their treatment plan, recognizing the value of peer support and the sense of community these programs offer. Some counselors also incorporate elements of the 12-step philosophy into their therapeutic approach, such as the emphasis on admitting powerlessness over addiction and the importance of making amends. Harm reduction strategies. Harm reduction is an approach that focuses on minimizing the negative consequences of substance use rather than insisting on complete abstinence. This approach is based on the understanding that not all clients are ready or willing to stop using substances entirely, and that any positive change, no matter how small, is valuable. Examples of harm reduction strategies include needle exchange programs, safe consumption sites, and providing education on safer drug use practices. In counseling, harm reduction might involve setting goals to reduce the frequency or amount of substance use, rather than expecting immediate abstinence. This approach can be particularly effective with clients who are deeply entrenched in their addiction or who have experienced multiple treatment failures. Holistic approaches to substance abuse counseling consider the whole person, addressing not just the addiction but also the physical, emotional, social, and spiritual aspects of well-being. These approaches may include complementary therapies such as yoga, meditation, acupuncture, and nutrition counseling. Holistic counseling often involves collaboration with other healthcare providers, such as nutritionists, acupuncturists, and fitness trainers, to create a comprehensive treatment plan that supports the client's overall health. This approach recognizes that addiction affects every aspect of a person's life and that recovery requires a multidimensional approach. 5. Challenges faced by substance abuse counselors. Emotional and psychological challenges working with individuals struggling with addiction can be emotionally taxing. Counselors are often exposed to stories of trauma, loss, and pain, which can lead to secondary trauma or compassion fatigue. The emotional weight of witnessing clients' struggles and, at times, their relapses can be overwhelming. To manage these challenges, counselors need to practice self-care and seek out supervision or peer support. Regular self-reflection and mindfulness practices can help counselors maintain their own emotional well-being while continuing to provide effective care for their clients. Dealing with relapse is a common part of the recovery process, but it can be discouraging for both clients and counselors. Counselors must help clients view relapse not as a failure but as an opportunity to learn and grow. This requires a non-judgmental and supportive approach, helping clients identify the triggers that led to relapse and develop strategies to prevent it in the future. Counselors also need to manage their own feelings of frustration or disappointment when a client relapses. Understanding that relapse is often part of the journey to recovery can help counselors maintain hope and resilience in their work. Burnout and self-care. Burnout is a significant risk for substance abuse counselors, who often work long hours in emotionally demanding environments. Signs of burnout include emotional exhaustion, reduced empathy, and a sense of disillusionment with the work. To prevent burnout, counselors need to prioritize self-care, set boundaries between work and personal life, and seek regular supervision or peer support. Self-care strategies might include regular exercise, maintaining a healthy work-life balance, engaging in hobbies, and taking time off when needed. Counseling organizations can also play a role in preventing burnout by providing resources such as employee assistance programs, wellness initiatives, and opportunities for professional development. Legal and ethical issues. Substance abuse counselors often face complex legal and ethical issues, particularly around confidentiality, mandatory reporting, and dual relationships. For example, counselors must navigate the legal requirements for reporting child abuse or threats of harm while also maintaining client confidentiality. They must also be careful to avoid dual relationships, where the counselor's role as a therapist might conflict with other roles, such as a friend or business associate. Ethical decision-making in these situations requires a deep understanding of both the law and the ethical guidelines of the counseling profession. Counselors must be prepared to consult with colleagues, supervisors, or legal experts when faced with challenging ethical dilemmas. 6. The impact of substance abuse counseling on clients. Success stories. Success in substance abuse counseling can take many forms, from achieving long-term sobriety to making small but significant changes in behavior or mindset. For example, a client who initially resisted treatment might eventually embrace the process and make meaningful progress in their recovery. Another client might achieve sobriety after multiple attempts, demonstrating resilience and determination. These success stories are a testament to the power of counseling and the human capacity for change. They also highlight the importance of persistence, both on the part of the client and the counselor. Celebrating these successes can provide motivation and hope for both the client and the counselor. Long-term outcomes of substance abuse counseling vary widely depending on the individual, the severity of the addiction, and the support systems in place. Some clients achieve sustained sobriety and go on to lead fulfilling lives, while others may struggle with ongoing challenges, including relapse or co-occurring mental health disorders. Research shows that long-term recovery is more likely when clients have access to a combination of therapy, peer support, medical treatment, and a stable environment. Counselors play a critical role in helping clients build and maintain these support systems, whether through ongoing therapy, connecting clients with community resources, or helping them rebuild relationships with family and friends. The role of family and community support are crucial factors in a client's recovery journey. Substance abuse not only affects the individual but also has a profound impact on their loved ones. Family therapy is often a key component of substance abuse counseling, helping to repair relationships, build understanding, and create a supportive environment for recovery. Community support, including peer groups, faith-based organizations, and community centers, can also provide a vital network of resources and encouragement. Counselors often work to connect clients with these community supports, recognizing that recovery is not a solitary process but one that thrives on connection and social support. Measuring success, metrics and evaluation. Measuring success in substance abuse counseling is challenging, as recovery is a complex and individualized process. Traditional metrics, such as abstinence or reduced substance use, are important but may not capture the full picture of a client's progress. Other indicators of success might include improvements in mental health, relationships, employment, or quality of life. Counselors often use a combination of qualitative and quantitative measures to evaluate progress, including client self-reports, clinical assessments, and feedback from family or community members. Regular evaluation and adjustment of the treatment plan based on these metrics are essential for supporting ongoing recovery. 7. The future of substance abuse counseling. Emerging trends and innovations. The field of substance abuse counseling is constantly evolving, with new research and innovation shaping the way counselors approach treatment. One emerging trend is the integration of trauma-informed care, which recognizes the role that trauma often plays in the development of substance use disorders. By addressing underlying trauma, counselors can more effectively support their clients' recovery. Another trend is the growing use of evidence-based practices, which rely on scientific research to guide treatment decisions. This includes the use of standardized assessments, data-driven treatment plans, and ongoing evaluation of treatment outcomes. The role of technology, e.g., telehealth technology, is playing an increasingly important role in substance abuse counseling, particularly in the form of telehealth. Telehealth allows counselors to reach clients who might not otherwise have access to services, such as those in rural areas or those with mobility issues. It also provides a level of convenience and flexibility that can make it easier for clients to engage in treatment. In addition to telehealth, technology is also being used to enhance treatment through the use of apps, online support groups, and digital tools for tracking progress. These innovations offer new ways for clients to engage with their treatment and stay connected to their support networks. Policy changes and their impact. Policy changes at the local, state, and federal levels can have a significant impact on substance abuse counseling. For example, changes in healthcare policy that expand access to mental health and substance abuse services can increase the number of individuals who seek treatment. Conversely, policy changes that limit access to services or reduce funding can create barriers to treatment and negatively impact outcomes. Counselors need to stay informed about policy changes and advocate for policies that support access to care and the well-being of their clients. This might involve participating in professional organizations, engaging in advocacy efforts, or staying informed about legislative developments that impact the field. The growing need for counselors. The demand for substance abuse counselors is expected to continue growing in the coming years, driven by factors such as the ongoing opioid crisis, the increasing recognition of addiction as a public health issue, and the growing awareness of the need for mental health services. As the field grows, there will be a need for more trained and certified counselors to meet the demand. This growth also presents an opportunity for the profession to continue evolving, with new approaches, technologies, and policies shaping the future of substance abuse counseling. For aspiring counselors, this is an exciting time to enter the field, with the potential to make a meaningful impact on individuals and communities. 8. Case studies and real-life examples. Case Study 1, a successful recovery journey. John, a 35-year-old man, struggled with alcohol addiction for over a decade. His addiction had cost him his job, his marriage, and his relationship with his children. When he entered counseling, he was skeptical and resistant to change, having failed in several previous attempts at sobriety. Through a combination of CBT and motivational interviewing, John gradually began to open up about the underlying issues that fueled his addiction, including unresolved trauma from his childhood. Over time, he developed healthier coping strategies, rebuilt his relationships, and achieved long-term sobriety. Today, John is an advocate for others in recovery, using his experience to inspire and support others on their journey. Case Study 2: The Struggle with Relapse. Sarah, a 28-year-old woman, entered counseling after years of struggling with opioid addiction. She made significant progress in her recovery, staying clean for nearly a year. However, after a series of personal setbacks, including the loss of her job and a breakup, she relapsed. Her counselor helped her see that relapse is not a failure but a part of the recovery process. They worked together to identify the triggers that led to her relapse and to develop new strategies for coping with stress and setbacks. While the road to recovery has been difficult, Sarah continues to make progress, supported by her counselor and a strong network of peer support. Case Study 3: Integrating Family Therapy. Mark, a 42-year-old man, entered substance abuse counseling after his family staged an intervention. His addiction to prescription painkillers had strained his relationship with his wife and children, who felt angry, betrayed, and helpless. His counselor suggested integrating family therapy into his treatment plan. Through family sessions, Mark and his family were able to communicate more openly about their feelings and begin to rebuild trust. The counselor helped the family develop strategies for supporting Mark's recovery while also addressing their own needs and concerns. As a result, Mark's recovery became a shared journey, strengthening the bonds between him and his family. 9. Conclusion and reflection. The importance of compassion and empathy. At the heart of substance abuse counseling is compassion and empathy. Addiction is a complex and deeply personal struggle, and clients need to feel understood and supported in their journey to recovery. Counselors who approach their work with empathy are better able to connect with their clients, build trust, and create a therapeutic environment where clients feel safe to explore their challenges and work toward change. The ongoing journey of recovery from substance abuse is not a linear process but a journey with many ups and downs. Counselors play a crucial role in supporting clients through the challenges of this journey, offering guidance, encouragement, and hope. While the work is challenging, it is also incredibly rewarding, offering counselors the opportunity to witness the transformation and growth of their clients. The future of the field. As the field of substance abuse counseling continues to evolve, there is an ongoing need for innovation, education, and advocacy. Counselors must stay informed about the latest research, trends, and policy changes, and be willing to adapt their approaches to meet the needs of their clients. The future of the field is bright, with new opportunities to make a difference in the lives of individuals, families, and communities. Final thoughts: substance abuse counseling is a challenging but deeply rewarding profession. It requires a combination of knowledge, skills, compassion, and resilience. For those who choose this path, the opportunity to make a meaningful impact on the lives of others is a profound and fulfilling calling. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.